49ers All-Pro linebacker Fred Warner suffered an ankle fracture dislocation today against Tampa Bay. Let's break this down. Anytime you see an athlete being carted off in these air casts or splints, you can assume that there was a joint dislocation or severe fracture.
First concern here for doctors is the blood vessels and nerves of the tibia and fibula. The trauma and soft tissue destruction can cause bleeding and swelling that can lead to increased pressure in the compartment. This is called compartment syndrome, and it can cut off blood flow to the region. The risk of limb loss is reduced with gross reduction back to its normal alignment.
And we get an excellent example of the medical staff reducing that joint back into place here. A great and timely response that can save the limb. We see Warner plant that right foot here in slight plantar flexion, which leads to his body weight coming down through the ankle. Now you can see some friendly fire with 27 coming in from the lateral side, and he inadvertently causes an external blow from the lateral side. 27 is coming in from this side
while the foot is planted. This causes the leg to collapse inward, while the foot and ankle is being externally rotated in the opposite direction as it gets caught between the grass
and Warner's teammate.
This forced external rotation and eversion is essentially the same mechanism as a high ankle sprain. However, instead of stopping rotation here,
you can imagine the ankle continues to externally rotate to the point of breaking the bones of the ankle mortise and subsequently dislocating.
This requires full trauma protocol activation, and getting the athlete to the hospital as soon as possible becomes paramount.
Another big concern is if this was an open fracture or a compound fracture. That's when the bone is coming out of the skin. You're pretty concerned about an infection and increased complications. This injury typically requires surgical alignment of the broken bones and stabilization with screws and plates. Data predicts an average return to play within 7 to 10 months, with a return to 90% production after about 12 months from return. But return to full production is also contingent on the amount of ligament, tendon, and cartilage damage that he may have sustained.
Fred is one of the best players in the NFL, and this is another terrible injury for the 49ers. Wishing him a safe and speedy recovery.